POD is the pouch of Douglas. The pouch of Douglas is a narrow peritoneal cul-de-sac in the pelvis which is situated in the rectouterine space. This pouch of Douglas is continuous with the pararectal fossa of either side. So the boundaries of pouch of Douglas include that of the anterior boundary, posterior boundary, lateral boundary and the floor. So anteriorly, the pouch of Douglas is bounded by the peritoneal covering of the cervix, posterior vaginal fornix, and upper third of the posterior vaginal wall. Posteriorly, it is bounded by peritoneal covering on the anterior surface of the rectum. Laterally, this pouch of Douglas is limited by the uterosacral folds of the peritoneum, covering the uterosacral ligaments. The floor is formed by a reflection of anterior peritoneum onto the anterior surface of the rectum. The floor is 6 to 7 centimeters above the anal orifice. So below the floor, there is a thin fibrous tissue septum which is the rectovaginal part, and the contents of POD pouch of Douglas include, usually it remains empty but it may contain coils of intestine or omentum. Surgical importance of pouch of Douglas. Actually, the pouch of Douglas is the most dependent part of the peritoneal cavity. So intraperitoneal blood or pus usually settles down to the pouch of Douglas to produce either pelvic hematocele or pelvic abscess. The herniation of the pouch through the posterior fornix may occur, so it can produce enterocele. Vaginal ligation is done through the opening of the pouch of the Douglas, and Culdoscopy, culdosynthesis, or at times pneumoperitoneum is also done through the pouch. Nodules deposited in the pouch can help in the clinical diagnosis of pelvic malignancy, endometriosis, or genital tuberculosis.